welcome back to Med School Radio. I can't remember if I was in junior or senior high school when the song Tom Sawyer by Rush first came out. All I remember is that I used to crank it up.
Oh, I'm sorry. Did I break your concentration?
Okay, guys, here it is, the second and last secret whispering Med School Radio podcast for tonight, because the people upstairs are sleeping. And they're usually so noisy, but I know I gotta be quiet because they're sleeping. And so let's go for it. We're going to talk about the cerebrospinal fluid. Hey, another good thing about these podcasts is if you can't get to sleep, listen to one of my podcasts. Someone once told me that they're great for falling asleep because they're so boring, I think. Extremely boring. Unless you're studying for an exam, and then they are very interesting. Anyway, let's get into it. We're talking about CSF and some of the problems that can happen with the CSF. First, a snapshot. A 22-year-old male presents with altered mental status, fever, and headache. The patient is able to sluggishly answer questions. Passive flexion of the neck leads to spontaneous contraction of the hips. Pain is elicited when attempting to fully extend the knee, while his hips are at a 90-degree angle. A skin finding is shown to the right. You can't see it, can you? But it looks like red dots. Okay, the introduction. Function. Serves as a mechanical cushion for the CNS. It protects the brain against concussive injury. Removal of metabolites. Remember that CSF flow is one way. Hormone and hormone-releasing factor transportation. Homeostasis. Remember, CSF pH affects ventilation and cerebral blood flow. Think about the production. It is produced by the choroid plexus epithelial cells within ventricles. It is found in the lateral, third, and fourth ventricles, and reabsorbed into circulation by the arachnoid granulations. It enters dural venous sinuses, and the entire volume of CNS is recycled 2 to 3 times every day. Let's think about now the ventricular system communications first. The lateral ventricle leads to the third ventricle, and this is via the interventricular foramen of Monro. The third ventricle leads to the fourth ventricle, and this is via the cerebral aqueduct, or the aqueduct of Sylvius. And the fourth ventricle leads to the subarachnoid space via the foramina of Luschka. This is lateral. Remember, Luschka is lateral because they're both L. And the foramen of Magende, which is medial. So Magende is medial. And compared to the serum, there is much less protein. And there's lower glucose, lower pH, lower potassium, calcium, and magnesium. But it has the same sodium. So think about the presentation, and you're probably going to see this on the test, so you should have these down cold. Let's just basically summarize these here. Okay, so normal. So the opening pressure would be about 20 centimeters of water. Color would be clear. Cell count 0 to 5 cells. Protein less than 45, and CSF 45 milligrams per deciliter. CSF serum glucose would be greater than 0.6. Okay, bacterial. The opening pressure would be increased. It would be cloudy. You would have an increased cell count of PMNs, increased protein, and you'd have lower serum glucose. How about for viral? You would, as for the opening pressure, it would be normal or slightly increased. Clear color, increased lymphocytes, slightly increased protein, and normal CSF serum glucose. For fungal or TB, you'd have an increased opening pressure. Color would be cloudy, increased lymphocytes, increased protein, and decreased serum glucose. Okay, moving on. Let's talk about hydrocephalus. Are you getting sleepy? I'm not, because this is important for me. Hydrocephalus. Dilated ventricles via several types. Let's talk about communicating first, where there is a decrease in the reabsorption of CSF, scarring of arachnoid granulations following meningitis could be an example of this. An increase in production of CSF. This is rare, and this would be with a choroid plexus papilloma. For non-communicating or obstructive, there would be obstructed flow of CSF, stenosis at narrow point along the ventricular system, for example at the cerebral aqueduct or the foramen of Monro, or in a Chiari-2 malformation or Dandy-Walker syndrome. Now, normal pressure or NPH. That is a decrease in reabsorption of CSF with chronic dilation of ventricles and normal CSF pressure. Remember that. I'll say that again. A decrease in the reabsorption of CSF with chronic dilation of ventricles and normal CSF pressure. A distortion of the corona radiata produces a triad of, and think of wet, wacky, or wobbly, urinary incontinence, dementia, and apraxic gait. This is for normal pressure hydrocephalus. The imaging would show enlarged ventricles on CT and MRI, and the treatment, a peritoneal shunt. And lastly, ex vacuo. There would be an increase in CSF due to a decrease in the brain size. An example of this would be Alzheimer's disease. And the ventricles would appear large, but CSF pressure is normal. So thanks very much for that.